Hi, my name is John Fanikos. I'm a pharmacist here at Brigham and Women's Hospital in Boston, Massachusetts. I've been a pharmacist here for many years. Both my dad's a pharmacist, my brother's a pharmacist. I've been around the profession of pharmacy and had a chance to counsel patients about their medications on a routine basis. I'd like to talk to you today a little bit surrounding the crisis in medication use as it applies or relates to medication adherence, actually having patients take their medications on a routine basis. You should recognize that we have about 300 million patients here in the United States. We spend about $2.6 trillion on healthcare supplies, and services. We spend about $300 million across Americans just on prescription drugs alone. Of that, if you average it out, the average American uses about $1,000 worth of prescription medications every year. About half of Americans take at least one medication every day. That use becomes magnified in our patients that are old or elderly in age. In patients that are over the age of 65, about 75% of patients take at least 2 medications a day. About 40% of Americans that are over the age of 65 take 5 or more medications a day. So the burden of medication use amongst our population of patients in the U.S. is pretty heavy. So we use a lot of medications. Do we actually do well in following the prescriptions that the physician has given to us? Well, the answer to that question is actually no. Over time, only about half of patients will actually adhere to the prescription directions that a physician has given them. There's a lot of reasons as to why patients don't comply with the recommendations that a physician has given after an office visit or hospitalization, but we know the problems start almost immediately from the time a patient is given a prescription to fill at their local pharmacy. Many patients will simply abandon the prescription. Many patients will go to the drugstore and drop off the prescription and never pick it up. And then there's a whole host of patients that will pick up the prescriptions, but over time, their compliance with that regimen that has been prescribed begins to wane. And as I suggested earlier, only about half of patients are able to maintain taking their medications on a routine basis, especially as it relates to chronic conditions, those conditions that patients will carry with them for the remainder of their life. If we look at the causes of why people fail to take their medications, I typically focus on 3 C's: cost, complexity, and cause. For many patients, the cost of the medications are a burden. Either they don't have adequate insurance or a prescription plan, and so whether there is a out-of-pocket expense or a co-payment that has to be made, many patients simply can't afford what has been given to them in terms of their medications. We find that many patients will try to adapt the regimen that has been prescribed by their physician. They'll split tablets in half and try to extend the amount of coverage that they have by taking half a tablet a day rather than a full tablet, or they'll skip medications, taking one day and then not the next day. None of these practices are good. We find that many patients just simply fail under the complexity, the burden of taking medications or many medications on a routine basis. If they can't orchestrate the number of administrations that need to occur during the course of the day and simply give up. And then finally, we have causes, and there are many patients that have side effects or adverse reactions to a medication. Many medications may cause things like fatigue. Patients get tired and simply don't have the energy to continue taking their regimen, so they just simply don't like the side effects that now impact their daily lifestyles. And then there are, in terms of cause, many medications that we give to patients or prescribe to patients don't have any discernible benefit. So with antibiotics, usually if we give them to a patient, patients feel better after an infection or a cold. If patients have pain and we give them an analgesic, usually the pain goes away. But for many of the chronic conditions that patients have, you can't identify that the drug is actually working by any benefit in terms of the way you feel. And that becomes important. What does failure to comply or adhere to prescribed medications result in? Well, there's a significant number, about 125,000 deaths in the United States every year are attributed to failing to take the medications as prescribed. But they also lead to additional office visits. They lead to hospitalizations because of progression of disease. And they lead to the introduction of either more expensive medications or more expensive therapies. It's estimated that the burden of failing to adhere to regimens that are prescribed accounts for about $290 billion in healthcare expense over the course of each year. So the amount of, by not taking medications, there are a whole host of complications that occur. Well, how does this relate to atrial fibrillation, which is the focus of our program? Well, we typically administer anywhere from 2 to 5 medications in patients that have atrial fibrillation. We may give medications for rate control or rhythm control, but underlying all the drugs we use, we typically administer an oral anticoagulant. So the drugs like warfarin, apixaban, dabigatran, edoxaban, rivaroxaban, all of these drugs are intended to provide benefit in reducing the rates of stroke and systemic embolism in patients that have atrial fibrillation. But they only will reduce that risk if patients take them on a routine basis. We know from the historical studies that the benefits of anticoagulant therapy are huge. They'll reduce the risk of stroke by as much as 60% in patients that take their oral anticoagulants. There are very few drugs that show that magnitude of benefit. If patients are prescribed aspirin, just taking aspirin will reduce the risk of stroke and systemic embolism by about 20%. So there is a huge benefit if we can keep patients on these oral anticoagulants as they're prescribed. But as I suggested, patients won't be able to identify or discern any benefit by taking oral anticoagulants on a routine basis. So they have to have faith in the drugs and that they will do what they're intended. Well, how can we have some success in terms of having patients adhere to the regimens of medications that have been prescribed by physicians or by their nurse or by their pharmacist? I think one of the most important things is having a good relationship and having faith in your physician and in your nurse and your pharmacist that if there is problems with a drug regimen, side effects, that you'll report them quickly to your practitioners or your clinicians so that they know and can make interventions or adjust regimens or switch to alternative drugs. I think it's important to have good relationships with your family members so that they know and can support you when you need to take your medications. As a pharmacist, I think it's critically important that as you take medications that you tie them or surround them with your daily activities that occur as part of your routine lifestyles. So for example, if you wake up in the morning and it's important for you to take your medication, perhaps you put it on the breakfast table if you're going to take it with breakfast. If you typically shower and brush your teeth, then put the medications in your bathroom so that you can take them while you, after you brush your teeth or after you shower in the morning. If you watch a typical TV show at night, like the evening news, and you take your medications at night, put them near the TV set so it will remind you to take them while you're watching your favorite show. So there are certain day-to-day activities I think that most people are accustomed to doing, and if we surround your medication administration with those activities, they become important reminders to comply with the regimens that have been prescribed. If for those that need alerts, there are smartphone applications that can alarm for when it's important for you to take your medications. You can embed those programs onto your laptop or your desktop computers if you work a lot or spend a lot of time at the computer system. And then for other patients that need a more rigorous calendar of activities, there are pill boxes that separate the day into times of drug administration. You can put your medications into those little compartments and carry that calendar box with you to keep you on target in terms of taking your medications. There isn't any one home run ball in terms of maintaining compliance or adherence to a prescribed medication. It represents a lot of work on behalf of the patient. It represents work on the clinicians that take care of patients to make sure that they inquire about patients taking their medications and that they do it on a routine basis. So I'll summarize. Medication adherence and following the directions of medications that have been provided by clinical practitioners remains a major problem here in the United States. Many patients fail over the long term to adhere to the regimens that have been prescribed by our physicians. This becomes incredibly important in the setting of atrial fibrillation, where we take these medications to reduce the rates of stroke and systemic embolism. We don't have a one-size-fits-all solution, and so it represents for patients using different strategies to try to employ or implement that keep you on the path of success on a day-to-day basis. Thanks for joining me today.